School administrators in Corinth are working to address parents' concerns after some 7th graders brought home an overdose drug last week.
On Wednesday of last week, students attended a session focused on drug and alcohol awareness. They were taught the warning signs of an overdose, and they were taught how to administer the overdose reversing drug naloxone. It's commonly distributed under the brand name Narcan. The people who ran this training, who were not directly involved with the school, then offered samples of Narcan to the students. Naloxone by itself is not habit forming and has virtually no effect on a person who is not overdosing. In a letter sent home to parents, the Corinth Middle School's principal says that school officials were not told about the Narcan distribution beforehand, adding, quote, "While we support efforts to educate young people about public health and safety, we also understand that there are a range of perspectives on the availability and use of Narcan, particularly at the middle school level." She goes on to say, "We believe that decisions about this kind of medical resource should be made by families in line with their values and beliefs." Now again, naloxone poses no threat to anyone who is not overdosing. Someone who does not have opioids in their system and takes Narcan generally does not feel anything after taking it. Some report feeling mild discomfort.
The school is offering more resources for parents who want to continue the discussion with their kids at home, but the training these middle schoolers received is becoming more and more common around the state. A few years ago, our Carly Dion attended a training in Southwest Harbor.
More than a dozen people gathered at the Southwest Harbor Public Library Saturday morning to learn something new.
They're attending this because they want to be able to help somebody and they want to be more knowledgeable in it.
Bar Harbor Fire Department Deputy Chief John Lennon is training the public on how to administer naloxone. Also known as Narcan, it's a medication that can quickly reverse opioid overdose.
I didn't know it was a nasal spray. I didn't know it was so easy to use.
Lennon began his presentation discussing some of the warning signs in someone who may have overdosed, including unresponsiveness or unconsciousness, difficulty breathing, snoring or gurgling sounds, and discolored lips or fingernails.
I learned a couple of the telltale signs that I didn't know, particularly the pinpoint pupils is something that I hadn't been aware of.
Lennon says step one in any emergency is always to call 911. Then, if you have naloxone on hand,
you can go ahead and give that Narcan and initiate that early on treatment.
Narcan nasal spray comes in a box like this, and it comes with instructions inside if you're unsure of what to do, but it's as simple as taking out this device, putting it up to one of their nostrils, and administering the spray.
Monitor the patient afterwards, put them in a recovery position, and wait for public safety to arrive.
The recovery position includes placing the person on their side, using their arms to prop up their head, and one knee bent for balance. Lennon says even if you only suspect someone has overdosed based on the signs, but aren't 100% sure, it's still best to give the treatment.
It does not adversely affect another medical condition that may be present.
Leo Cook runs Sawyer's Market, just a few doors down from the library. Cook says being prepared for an emergency like this is important as a business owner or even just as a neighbor, knowing every minute counts, waiting for first responders to arrive.
There's a big difference between 1 minute without oxygen in your brain and 5 and 6 and 7.
It betters your chances of a positive outcome.
Each person in attendance receiving a naloxone box to take home with new knowledge that could potentially save a life.
That was Carly Dion reporting. Public health officials reported last year there was a massive drop in overdose deaths, and they say a lot of credit goes to the widespread availability of naloxone.
The Centers for Disease Control and Prevention recently found that there were about 30,000 fewer overdose deaths nationwide in 2024 compared to the previous year. An estimated 80,000 people died from overdoses last year. That's also down 27% from the 110,000 in 2023. Maine's overdose death rate dropped by 20% last year. Overdose deaths in the U.S. hit their lowest in 5 years.